Emotionally, I'm okay most of the time. I wake up every morning, and of course, there's days the pain tries to take me down, but I don't allow it to. I get up and I keep fighting. I think I have 2 kids. I have to, something's got to lead me, you know, in that direction. I've got to take care of my babies. I've got to show them that nothing can keep you down. You can allow it to, but I'm not. I'm not going to allow it to keep me down.
And I think it should be noted, Tina, you're someone who had experience with a firearm.
Yes.
And so you got that firearm when your friends basically said, look, we're concerned for your safety. I just want to highlight, we have a few CT images of how significant Tina's injury is. And, you know, if you look at this CT scan, there's still a bullet in Tina's brain. Let's go to the next image, because when you see Tina, the right side of her face is fairly intact. You know, the eye socket, the sinuses, you can see where the bullet came through, just destroyed all of the structures on the left side of her face. Such severe destruction that obviously, as she said, they did what they could. We wanted her to get a better idea, though, of the current state of her injuries. We sent her to board-certified plastic surgeon, Dr. Adil Ceydeli at the Plastic Surgery Institute and Spa in Panama City, Florida.
I heard a little bit about what happened. Can you tell me a little bit more about what kind of surgeries did you have?
Okay, I was in the hospital 19 days. During the 19 days, I had several different surgeries performed. Reconstructive surgery on the entire left side of my face.
Okay.
One bullet went in here. I was cut from one ear to the other to withdraw fluid from my brain. The other bullet went in here, right under my left eye. Completely damaged the bone, the muscle, the nerves, all the way down. Come out right there and stuck in my shoulder.
You lost your vision completely on the left side?
I completely lost my eye on the left side.
Okay.
The damage was so bad they couldn't fix it.
From the brain surgery standpoint, were you cleared? Do you have any other issues related to your brain injury? Or?
None at all.
No?
My main problem is my jaw muscle was almost completely locked up. I had to have surgery on that to loosen the muscle up. I was told I'd have to have it done again. This bone is really uncomfortable. It cracks at times, makes noises. This, I'm not sure what that is right there, if it's metal or what.
Probably they put some plates there.
It's very painful, and it scares me. If I, you know, bump across my face, I'm scared it's going to come through the skin.
Okay, if you don't mind, let me examine you. This way. Is this the plate bothering you?
Yes, it is.
Okay. I know that you have quite complicated trauma to the face and the skull, but before we go any further, we have to get a 3D CAT scan to better evaluate what's going on in the bony structures and what kind of plating you have, and then probably I'll examine you one more time. Do you have any other questions?
No, sir. Everything sounds good. Thank you. When I was 16, I met Matthew. We got married, and we raised our 2 kids, Blaine and Gracie. 7 months after our divorce, we seemed to have a pretty cordial relationship, but then he started saying that I would never see my kids again. One night, Matthew and I had had a pretty ugly conversation over the phone. 1 o'clock in the morning, I got up out of the bed, walked in the living room, said, "Matthew, why are you doing this?" He hit me in the head with the butt of the gun. I knew I had a gun. It was in my pants drawer, and I asked if I could put pants on, and he said yeah. Grabbed the gun out of the drawer. I turned, pointed the gun. I pulled the trigger 3 times. Matthew shot me 3 times. I was shot in the head, under my left eye, and once in my forehead. I was also shot in my arm. The doctor had to remove my left eye. I had many surgeries to try to repair the damage. The pain is what really gets me. I'm tired of being in pain, but I don't give up. I keep fighting.
We're back with Tina. Dr. Ceydeli is also joining us. And, you know, we obviously see externally the damage that was done, but what did you discover in your exam?
Well, as you could see from the CAT scan and her clinical exam, there's quite a bit complicated trauma there. So she has some skull defects that you could see, and some palpable plates from previous reconstructions, and she lost the nerve function on the left side of her face, so she cannot open her left eye and she cannot move the left side of the face. So what I would do, it's a major procedure, but a procedure that I learned from my mentor, Dr. Flowers, in Hawaii during my aesthetic fellowship. The procedure called MAG5. It's essentially upper and mid-face rejuvenation, and it's all about the balance on the face and the symmetry. So with that procedure, it involves the brow lift, mid-cheek lift, subperiosteal, and eyelid tightening, and as well as upper eyelid surgery as well.
And I think it's worth noting, just to highlight the entire scenario, Tina lost your medical insurance. And so, obviously, a huge limiting factor there as well.
I'm willing to do that procedure. My service is free of charge, if she allows me.
What are you thinking, Tina?
We are gonna...
Thank you.
Yeah.
You're in good hands.
And
Thank
you
you so
deserve it.
much.
You do.
You deserve it.
So Dr. Ceydeli is going to figure out a way to make this happen. There are going to probably be some other expenses associated with it. That's why we reached out to Somi Ali, who runs a charity, a great charity called No More Tears. It's a charity dedicated to women who have suffered from domestic violence. Somi, tell us about your organization.
So No More Tears is a nonprofit, and our mission is to rescue victims of domestic violence as well as human trafficking. Our services include from therapy, counseling, legal assistance, medical assistance, driving lessons, jobs, education, anything that you can think of to empower victims of domestic violence. We were extremely, extremely touched by your story, and we would like to present you with a check for $10,000.
That will help.
To help cover your medical expenses.
Thank you so much. Thank you.
1,300 women die each year in the United States because of domestic violence. And you are such a survivor, and we're so proud of you.
Thank you.
And we're just proud to even have you on our show.
You.
So,
And I would also, Somi, I'd like to give you a round of applause for what you're doing.
Yes.
And your organization. And certainly, if you're watching and you would like to donate to No More Tears, or you would like to speak to someone at their crisis hotline, just check out our link on thedoctorstv.com. Tina, we cannot wait to have you back on the show.
Thank y'all so much.
Dr. Ceydeli, we can't thank you enough for offering your services. And again, Somi, for what you're doing with No More Tears, we're so grateful. Let's see what's coming up.